Raymond Dwyer, retired yacht captain. 72 years old. So I knew about the importance of yearly checkups. My wife's mother and father were doctors. Therefore, every year in Hamburg, Germany, we did a complete checkup. I had a urologist for over 20 years. We did ultrasound and full checkups for the PSA. That was the yearly routine. I knew the importance. When the cancer was diagnosed, that was a shock, of course. I know somewhat why it was evolving, which we all have problems with some stress and anxieties in our lives, and that was the evolution, but a very shocking diagnosis when it was actually. The urologist and the family doctor in Hamburg, Germany, they were convinced that immediately I was to be in the clinic next door and have it removed. But I knew from my father's occurrence and his life ruined from the removal, I knew right away that I was not going that route. It was just not going to happen. There were other ways to do this. When I first got back to Colorado and went to the Shaw Clinic, all they offered was fear and what they knew how to treat, which was hormone and radiation. And then through the later MRI and a bone scan requested by Dr. Bianco, we could see that the prostate size had greatly increased.
It's mind-boggling that just about 10 years ago, I was deeply immersed like others in the traditional approaches for prostate cancer. For me as a urologist, it was robotic surgery and hoping that I was changing their life and making it better. However, critical research came out, highlighting the problems with the traditional approach. Many men were robbed of their sexual potency, and some even became incontinent, while really gaining very little survival. The approach was extreme. Either do nothing or radically treat with surgery or radiation.
And therefore, I did not believe in what they were selling. So I decided to go out on my own and treat holistically. The first 3 years were somewhat successful. We had a reduction in the size of the tumors. We had the PSA coming from 32.5 down to 3.76, which was well within the norm. So therefore you thought, well, things are going quite well here. It wasn't until the 5th year that things really started to turn and not in a favorable result. It was not until the 5th year that all of the symptoms they were telling me started to occur, and they were occurring rapidly. My older sister was going through Tony Robbins' new book, and she discovered that he had done this procedure to treat his BPH, his enlargement. And she called me one night and said, you got to look into this right away, because this could be really something for you. It's called Focalyx, and check it out on Focalyx.com.
We needed to think different. We needed to come up with something that was more measured. One that was not a life-changing event, where you could destroy the cancer cell and you can preserve the prostate function, urinary or sexual. So the answer was Focalyx, an ultra-targeted, disruptive innovation that allows surgeons like me to destroy cancer cells while preserving the prostate function, so patients don't experience urinary incontinence or impotence.
I'm happy just to have made it to this procedure. That's how far advanced it was. After the procedure, within 2 weeks' time, my urinary function was all of a sudden back to as if I was 20 years old. I mean, I had control of it. I had, full flow of it. It was just beyond your belief as far as the urinary function goes. What will my quality of life be if I do what the Shaw Cancer Center wanted? What will my quality of life be if I proceed and go holistically? So everyone has to make that decision. But if I were to do it again, I only wish that I knew about Focalyx 5 years prior. But thank God for Tony Robbins and his wonderful, wonderful book that shows us and tells us of these procedures that no one knows.
So life is an evolving thing, and everything is changing. So we'll continue to innovate, investigate, and focus on those treatments that are better tailored to our patients.